We begin at 5 o'clock with the latest on the coronavirus outbreak. Good evening and thanks for joining us on this Monday. I'm Dennis House. At least 6 people have died from coronavirus here in the U.S., all of them in Washington state. Experts there believe the virus has been spreading for weeks and nobody knew. Tonight, there are cases on all sides of Connecticut. Massachusetts has 1, along with New York and New Hampshire. Rhode Island has now 2 cases. The coronavirus has certainly triggered fear, but the U.S. Surgeon General is urging people not to panic. Channel 3 Eyewitness News reporter Susan Raff is live at Hartford Hospital with more on the Surgeon General's message. Susan?
Dennis, the U.S. Surgeon General definitely says that we should all be prepared and concerned, but not to panic. Here at Hartford Hospital, they have been preparing for a while. As you know, as you mentioned, there are no cases of the coronavirus have been reported here in Connecticut, but some feel it could be just a matter of time. At this point, the risk is low, and they're trying to keep it that way.
So it used to be that you had to have a connection with a coronavirus positive or suspect patient.
U.S. Surgeon General Jerome Adams met with Governor Lamont and state health officials. He got a tour of the public health lab. This is where testing is done on infectious diseases. And last Friday, they started testing for the coronavirus.
We've seen an increase in cases in the United States over the weekend. I want folks to understand that we knew this was coming. We told folks that this was going to happen, and it is why we've been preaching preparedness from the very start.
The U.S. Surgeon General has some advice on how communities can protect themselves.
Coronavirus is new, but we've dealt with SARS, we've dealt with MERS, we've dealt with H1N1.
With all infectious diseases, protection starts with thorough hand washing and using hand sanitizer and avoiding people who are sick. Adams says face masks should only be for health officials and those who are sick. He says people often put masks on incorrectly, and that could increase your risk of getting infected. And to keep the virus from spreading,
take your flu shots. That means less likely you're going to be in the hospital emergency room, more room for us to be able to pay attention to the coronavirus.
the U.S. Surgeon General and health officials say when it comes to hand washing, you should do it for at least 20 seconds. That means thorough, 20 seconds or more. Coming up on Eyewitness News at 6, what is all this testing costing the state of Connecticut and also the budget across the country? And a doctor weighs in on things that we should all be aware of. For now, we're live in Hartford. Susan Raff, Channel 3 Eyewitness News.